vegan, favorite of heavens.
Our programs offer many languages. Please visit suprememastertv.com/schedule.
Nos programmes offrent plusieurs langues. Veuillez visiter suprememastertv.com/schedule.
Nuestros programas ofrecen varios idiomas. Visite suprememastertv.com/schedule.
Rancangan kami menawarkan banyak bahasa. Sila kunjungi suprememastertv.com/schedule.
Researchers from the Physicians Committee for Responsible Medicine conducted a meta-study drawing from 150 studies related to asthma and nutrition, and the results suggest that a vegan diet can help decrease the risk of developing asthma and manage symptoms. Continue watching to find out more.
Guten Tag translates to good day in Dutch, the official language of Splendid Sabah, a special municipality of the Netherlands. Noble viewers, I am Rolando. The kind people of Sabah wish you to have a healthy body and mind to carry you forward on the road of enlightenment. Welcome to today's program, How to Control Asthma Attacks. Asthma is a major chronic inflammatory disease of the airways to the lungs and the most common chronic condition in children. According to the World Health Organization, in 2019, approximately 292 million people worldwide were affected by asthma. Typical asthma symptoms include wheezing, coughing, shortness of breath, and chest tightness. Although it has a relatively low fatality rate compared to other long-term diseases, asthma may happen several times a day or week, causing sleep disorders, reduced activity levels, dizziness, and fatigue, thus creating considerable hardships for the sufferer and their family. The root cause of developing asthma is a combination of complex genetic and environmental interactions that are not fully understood. For children, genetic tendency plays a large role in whether the individual develops asthma or not. On the other hand, environmental and lifestyle risk factors are dominant for adults. The major triggers of asthma are inhaled allergens such as dust mites, pollen, dander, air pollution, cold air, certain foods and food preservatives, chemical irritants in the workplace and tobacco smoke, respiratory infections like the flu or cold, certain medications and stress are possible asthma causes as well. Although asthma is often a lifelong condition, effective medical management can assist people in controlling asthma attacks. Short-term medications via inhalers can provide quick relief of symptoms and make patients breathe easier. Long-term treatments such as inhaled corticosteroids can make a patient's airways less sensitive to asthma triggers. Developing and following an asthma action plan with a doctor is advised, including the tracking of the severity of symptoms and frequency of episodes, medication required for different symptoms, and what to do in case of emergency. By effectively managing the condition, one can still enjoy a good quality of life. Avoiding allergens is a very effective approach to reducing asthma attacks other than the use of medications. The first thing to avoid is tobacco smoke exposure. Tobacco smoke is extremely harmful to people with asthma as it contains lots of toxic irritants, including tar, carbon monoxide, nicotine, and others, causing mucus buildup in the lungs and damage to the respiratory cilia that move mucus and pathogens out of the airways. Other than being a powerful asthma trigger, tobacco smoke also contains various chemicals that can cause cancer, a heart attack, or stroke. This smoke is extremely unhealthy for everyone. Second-hand smoke is especially dangerous to non-smokers, as their bodies are not accustomed to the toxic substances in tobacco smoke as smokers are. To limit first-hand and second-hand smoke exposure for yourself and your family, the most beneficial way is to quit smoking if you are a smoker. You should start seeing the improvements, easier breathing and fewer symptoms within a few days as your lungs begin to get rid of the tobacco smoke toxins inhaled. Your doctor can advise on how to give up smoking, and there are plenty of different treatments available and local support groups to help you achieve your stop smoking goal. Ask your guests not to smoke in or near the house and not in the car. Stay away from places that allow smoking. By avoiding smoke exposure, you can lower your asthma risk and ease day-to-day asthma symptoms. Please, bear in mind that switching from conventional cigarettes to e-cigarettes will not alleviate asthma. Much recent research indicates that the chemicals in e-cigarette vapor, such as propylene glycol and vegetable glycerin, are likely to worsen asthma symptoms. Strong emotions like anger, crying, and excitement can trigger asthma too. When experiencing strong emotions, your breathing changes and airway muscles tighten, thus inducing asthma. Breathing techniques, relaxation exercises, and meditation can help you deal with strong emotions. Mindful breathing is a sound emotional asthma control strategy recommended by the Asthma and Allergy Foundation of America, or AAFA. Here is AAFA's approach. Start by breathing in and out slowly. Breathe in through your nose and out through your mouth, letting your breath flow easily. Try inhaling for 7 seconds, holding your breath for 7 seconds, and letting your breath out for 7 seconds. While focusing on your breathing, try to let go of other thoughts and just be in the moment. Try doing this for 3 rounds. We will now pause for a constructive message. When we return, we will introduce more asthma control tips. Please stay tuned to Supreme Master Television. Be vegan, make peace. Welcome back to How to Control Asthma Attacks on Supreme Master Television. Approximately 90% of asthma patients may experience a particular form of asthma attack called exercise-induced bronchoconstriction, or EIB, during exercise. When people exercise, the increased oxygen demand makes people breathe more through their mouths, thus inhaling cooler and drier air than when they breathe through their noses. The cooler and drier air can lead to airway narrowing and trigger asthma symptoms. EIB symptoms may start while exercising and then usually become more intense 5 to 10 minutes after exercise and may require an additional 20 to 30 minutes to resolve. If you are diagnosed with EIB, you still can enjoy the benefits of physical activity and exercise with proper management. Swimming in a warm, humid environment is a good exercise for people with EIB. Hiking, leisure biking, and walking are also suitable activities. Cold weather sports like ice hockey and skiing, on the other hand, may worsen EIB symptoms, same as exercises requiring sustained activity like basketball and soccer. In addition to medication, do appropriate warm-up before exercise. Putting a mask or scarf over your nose and mouth also helps to prevent EIB attacks when the weather conditions are cold and dry. Air conditioning is also excellent for asthma control. Humidity is likely to trigger asthma attacks as humid air is harder to breathe, activates the nerves in your lungs to narrow the airways, and is stagnant enough to carry more airborne asthma allergens like dust mites, pollen, mold spores, and animal dander. Your air conditioning unit can manage the humidity in your home and help you control asthma. The air conditioner's filter can remove the previously mentioned allergens as well as outdoor air pollutants, thus improving indoor air quality and minimizing the number of asthma episodes. For the air conditioning units to lower airborne asthma triggers effectively, the filter needs to be properly maintained and periodically replaced. On the other hand, while sleeping with a fan on at night may make you feel cool and comfortable, it can blow allergens and dust into the sinuses and exacerbate asthma flare-ups. If you cannot let go of your nighttime breeze, make sure you clean the fan blades and your room and change your bedding regularly to minimize the allergens and hence lower the probability of waking up wheezing. Being vegan could be beneficial for asthma prevention and treatment according to a paper on asthma and diet published in Nutrition Reviews. Researchers from the Physicians Committee for Responsible Medicine conducted a meta-study drawing from 150 studies related to asthma and nutrition, and the results suggest that a vegan diet can help decrease the risk of developing asthma and manage symptoms. Conversely, dairy products and foods high in saturated fat and low in fiber increase the risk and aggravate symptoms. A plant-based diet is rich in antioxidants and flavonoids, which reduce systemic inflammation that can worsen asthma. Besides, the high fiber content in fruits, vegetables, and whole grains is positively associated with good lung function. In a 2004 study, children that had eliminated dairy and egg intake for 8 weeks experienced a 22% improvement of their peak expiratory flow rate, a measure of how fast a person can exhale. One of the meta-study's authors, Dr. Hanna Kaliova, Director of Clinical Research at the Physicians Committee for Responsible Medicine, concludes, this groundbreaking research shows that filling our plates with plant-based foods and avoiding dairy products and other high-fat foods can be a powerful tool for preventing and managing asthma. Here is an inspiring story about how switching to a plant-based diet reversed asthma. Rob Dubé, an American entrepreneur and athlete, was diagnosed with severe asthma and eczema at the age of 8. From that point on, he had to use a rescue inhaler and various medications constantly. In 2011, after watching the documentary Forks Over Knives that examines how a plant-based diet can help one avoid and reverse serious chronic diseases, he decided to try a vegan diet. Soon, he noticed his asthma and eczema symptoms had lessened, and eventually, he stopped using the medications that he had relied on for 33 years. Better still, his physical fitness has improved significantly since then, allowing him to complete many marathons. If you are suffering from asthma, why not give the healthy plant-based diet a try? You too may find that your chronic symptoms disappear. Thank you, wise viewers, for your company today for our program. Up next is Moving Towards a More Conscientious World, Part 8 of 9, on Between Master and Disciples, right after noteworthy news. May the Providence guide and protect you always.
Our programs offer many languages. Please visit suprememastertv.com/schedule and suprememastertv.com/HL.
Killing is never right. Peace is the only answer.